Welcome to the Healthy Relationships Initiative podcast. Our goal is to provide information and tools to help you build happier, healthier, and safer relationships of all kinds. To learn more about HRI, please visit www.guilfordhri.org.
All right, it is 12 o'clock, so we will go ahead and get started. I want to take this time to welcome everybody to today's Healthy Relationships Initiative Relationship Booster. The topic for today's program is on supporting a loved one who's facing an addiction. My name is Christine Murray, and I'll be facilitating our program today. I am the director of the Center for Youth, Family, and Community Partnerships at UNC Greensboro, and I also direct the Healthy Relationships Initiative. Our mission for the Healthy Relationships Initiative is promoting happy, healthy, and safe relationships of all kinds. And we invite you to check out our website at guilfordhri.org to connect with more of our resources, as well as find us on social media at Healthy Relationships Initiative. Before we start, for those of you who are here with us for the live program today, I wanted to cover a few quick details. Please do feel free to share questions at any time throughout the program, and we will try to cover those as we're able, or we'll save some time for them at the end. So we welcome your questions. Please feel free to comment at any time. And before you sign off today, if you could please complete the quick feedback form that Camilla will be posting in the chat room before we sign off. As I mentioned earlier, the topic for today's program is supporting a loved one who's facing an addiction. And I'm very excited to introduce you to our special guest for today's program. An expert on this topic is Bernard Shalvey. So Bernard, if you could, please go ahead and introduce yourself and tell us a little bit about your background and your work in this area and why this topic is of so much interest to you.
Yeah, absolutely. Thanks for having me here, Dr. Murray. And, I'm definitely excited to be a part of this and the Healthy Relationships Initiative. My background is mostly in, couple and family counseling and clinical mental health counseling. I've worked here at Fellowship Hall for the past year or so. I work as a primary counselor in this program. And so we're an abstinence-based 12-step philosophy program that works to, basically transition individuals that are suffering from substance use disorder, take them through 28 days of inpatient treatment. And, it's the ICU of addiction treatment. It's the highest level of care. And so, yeah, we basically are addressing substance use disorder and assessing for any co-occurring disorders or things that we can address moving forward. But we recognize we have 28 days, and comparing 28 days to a lifetime of addiction, it's just a drop in the bucket. So, but yeah, we're assessing for anything else that might be present and seeing what we can do in that time. But anyway, yeah, I've worked here for about a year. Prior to that, I worked in the family program as an intern. And so the family program is a 4-day kind of intense program for individuals who are family members or sometimes friends, but mostly family members of the guests who are here in treatment. And so a lot of the information that I'll kind of be pulling from today is based on my experience working in the family program. But prior to that, working with couples at the VAC clinic at UNCG, working with individuals there, working a little bit with you, Dr. Murray, doing some research on access to resources for domestic violence, and as a graduate assistantship. Prior to that, I have a little bit of experience working in a PRTF, a psychiatric or residential treatment facility with adolescents. And yeah, addiction and individuals who are in relationships with those who suffer from addictions, this is definitely something I'm passionate about and have a lot of personal and professional experience with, in my own life, in the lives of friends and family members. And so to be able to share my experience and also my professional background on that, I'm definitely, grateful to be here and have the opportunity to do that.
Great. Thanks so much for sharing more about your background. And yes, in the spirit of full disclosure, you are a former student of mine, but it's great to see you back. And it's just been, great to see you stepping into your career. And I know that this has just been a topic that's been something that you've been passionate about for many years, even before you started the program. So I'm really excited to really kind of reverse roles and learn from you today, Bernard. And so let's just dive right into this topic. And I think before we even really get into this topic, it might be helpful to go over some real basic background information of, how do we know when a loved one, especially if they're not disclosing it or ready to acknowledge the role that addiction or substance abuse is playing in their life, how can people know when a family member or a loved one is experiencing problematic use of substances? And just as a little additional context for that, some people who are not going to be watching this program live, but might be watching it another time, might not realize, but we're actually right in the middle of the coronavirus pandemic.
Yes.
And I know that there's been a lot of news stories about how alcohol, substance use has really increased during this time. And so I think that's a good starting place for this conversation, is just sort of, if you have a family member or a friend and you're noticing maybe some problematic habits or patterns in that area, how do you know if it's an addiction?
Yeah, and that's a great question. And it's not one that's really easily answered because of just the variety of substances that people could be using. But, definitely recognizing changes in behavior. So a lot of times they're drastic changes in behavior when use becomes like problematic. And so I want to first kind of say that I'll be like using the word addiction today a lot. And what I'm kind of referring to is people who meet the DSM criteria for a severe substance use disorder or a substance use disorder in general. And so a lot of the a lot of what I'll be referring to is addiction, but I'm talking about that basically. Also, I want to add that when I'm saying like addiction, I'm including alcohol kind of in there. And whenever I mention drugs, I'm also including alcohol. And so just to kind of clarify there, because a lot of times like in our culture, in our culture, those are kind of two separate things. But I, talk about them as one. And so yeah, what are some signs, what are some things that I can notice that my loved one is experiencing that might be indicative of a substance use disorder? Like I said, drastic changes in behavior. They're going to be experiencing consequences, internal and external, from the inability to stop using drugs. And so sometimes they're easier to spot than others. Sometimes, the internal consequences can be harder to see. And so the external consequences, are the very obvious DUIs, charges, convictions, things like that. But it can also be things like changing in friend groups. It can be changing in interest or complete lack of interest in things that were, once pleasurable or interesting. And then of course there's physical symptoms that kind of come along with becoming dependent on a substance. And that's kind of where the variation comes in. If someone is using, for example, opiates, and the substances are no longer there, and they're going to go through a detox process that looks a lot like somebody suffering from the flu. Where on the other hand, if somebody's going through detox from stimulants like cocaine or methamphetamine, they're going to be kind of going through a more psychosis coming off of those stimulants, which can kind of at times look like schizophrenia. And so, there's definitely two very different examples just in that. But I would say if you know the individual, the person, and your intuition is telling you, I'm not looking at them anymore, I'm looking at a completely different person, it could be because drugs. That's just, I guess, a simple kind of answer to it. And to be able to trust your own intuition to say, like, these aren't the type of things that, this person does, and why are they behaving so erratically? the answer to that could possibly be substance use disorder. Yeah.
And I think what can be especially challenging in that situation is a lot of times people don't necessarily admit it for themselves. And so for a friend or family member or a partner to be watching somebody who they're noticing some of these changes, very difficult.
Yeah. Yeah. And that's, I mean, that's a great point, because a lot of what I'll kind of be touching on today is, yeah, from that perspective of the individual looking in on the addict or alcoholic. And yeah, I mean, there is a sense of shame that comes along with the stigma of addiction. And so there's a very, it's very likely that individuals will want to deny that, as long as possible. And whether that's subconscious or conscious, whether they know that's coming from a place of stigma and shame is kind of irrelevant. But a lot of times what will happen is, yeah, I don't want to admit that my husband, wife, daughter, friend, whoever, is struggling with addiction. Yeah.
And so let's kind of start there. We'll talk in just a minute about if somebody does, if a loved one does come to you and say, I'm struggling with an addiction, or my substance use has gotten out of control. But let's start with, if you as a loved one have concerns about somebody, you've noticed these things, you've noticed the changes, maybe you've witnessed or observed the level of use of the substance. What are some tips? I know we've kind of, sometimes the terminology of like an intervention can be used, but so if you could share some guidance on how to address those concerns with somebody in a way that is most likely to be a constructive conversation.
Yeah, that's a great question. Some things to consider. So definitely approaching it with empathy, as in any situation, where you're trying to provide support. And one of the ways that you can kind of tap into that empathy is by educating yourself more on what is addiction, the disease model. So I think it's really important to recognize addiction as a disease. And so if I can say this individual is suffering from, the disease of addiction rather than a moral deficiency, it makes it a lot easier to have understanding and empathy and concern. If I'm approaching them saying like, thinking that they're making the decision to continue using, it's going to be very hard for me to have empathy for that person. And so I think first and foremost, just educating yourself on what does the disease model of addiction mean? And I think approaching it from that is a huge, huge step and will help anybody who's in this situation. I think the second thing is recognizing that addiction in and of itself is traumatic. And so when you're going through addiction, you're making decisions based on a perceived sense of fight or flight, a perceived sense of survival. And so using these substances because I have to survive, not I'm making a choice to do this because I want to, or any other kind of explanation. And so that in and of itself, is a traumatic experience, doing something against your own will. And then of course the consequences that come from that are, vary in every situation, but understanding that and approaching it with that understanding of like, wow, what you're going through, what you've gone through is traumatic. And then also having that piece of knowledge that, it is a disease, can be really helpful. Those are kind of the first two things I would mention. The third we've kind of touched on already, but it's just the stigma. Reminding yourself that there is a stigma around addiction and what it means to have an addiction. And so if you can approach it with that in mind, you likely be able to come from a more understanding place and recognize that that person's probably feeling a sense of shame, guilt, or, just general kind of embarrassment over the fact that they're unable to stop.
And so let's say what happens when you raise those concerns, even if you approach it in a very sensitive, empathetic manner, trying not to be stigmatizing. But what can you do if you approach your loved one and they're like, I don't have a problem leave me alone, back off kind of thing, if they, maybe get defensive about it or just say, I don't have a problem?
Yeah, yeah. I mean, that's one of the biggest challenges, because as you approach these situations, if the individual is currently using, yeah, those defense mechanisms are going to come up, and so in that situation, I think recognizing that you have a choice. You have a choice to enable their recovery or enable their addiction in that moment. And if you're seeing consequences, if you have your own evidence that shows, okay, this person isn't who they are right now. They are completely different when they're using. There's innumerable consequences that have come from this, internal and external, and then they're still denying it or minimizing it or coming up with an explanation for why it is the way it is. Yeah, at that point, it's kind of a question of, okay, how do I set a boundary? How do I take care of my own well-being and protect myself, and not enable their addiction? And so that kind of, yeah, being able to understand that, I can't control them, but what I can do is control my own behavior. And if I see it, call it for what it is, and be able to kind of stand behind that.
And I think with that in mind, it's possible to set that boundary and say, I'm going to need to, whether it's I'm going to need to distance myself, or I don't want to be around you when you're using substances, or whatever boundaries that a person feels right about setting. But then at the same time, keeping that empathy and still being able to say, but I'm here for you if you ever need to talk, or if you do decide you want to reach out for help, I'm here for you. But I think, being able to balance that sometimes can be very tricky when you really care for your loved one and you want the best for them.
Absolutely. And I think, one thing to kind of think about, like in that situation, and when that happens, being able to say, like, either to yourself or out loud or to them, like, I'm not talking to my loved one. I'm not talking to my wife or my daughter or my husband or whoever. I'm talking to the addiction right now. And so having that kind of in your mind makes it a lot easier to kind of say, like, okay, this isn't how they would normally treat me. This isn't them. And so their addiction is present and is trying to protect itself by any means necessary. And that can be extremely hurtful and extremely difficult. But being able to at least recognize, okay, this isn't them, it can be, I think, helpful for both people involved.
Yeah, I think that's really powerful because, it's difficult in those moments not to just get frustrated with your loved one, or to, be upset that they didn't receive your help, or they don't believe you if you're thinking that you have concerns. And so, kind of reminding yourself what position they're in right now, and that's impacting how they're responding to you, while you're still taking care of yourself. And I would just really echo, and I guess also added as a question to you, getting that support for yourself. If you are concerned about a loved one facing addiction, you might be thinking, I need to take care of this other person. I really want to help them. They need my help. But really, you might need more support in that moment, or at least maybe you both need the support, but you're going to be more willing to accept that. And so what are some good sources of support for somebody if they've got a loved one facing addiction who's not ready to seek help?
Yeah. I mean, that's one of my favorite things to talk about is that question you're asking. And the reason why is because it's so often people, family members and loved ones of, addicts or alcoholics who are guests here in treatment, or in general, in my own personal experience, they, have these questions of like, what do I do? How can I help them? How can I do something positive for them? And, it can be very, upsetting to realize a few things. And we talk about it in the family program as the 3 C's. You didn't cause it, you can't cure it, and you can't control it. And so to learn that, it's kind of like, you're like, what do I do then, if I can't fix it? And so, you can, however, enable. You can enable in a positive way, or you can enable their addiction, so enabling recovery or enabling addiction. But being able to recognize, like, okay, if I can't cure it, cause it, or control it, what can I do for myself? What actions can I take to heal from this? And what are some things that I can put in place, some boundaries to protect me? And so, I'm a big advocate for Nar-Anon and Al-Anon, which are programs for individuals who are in a relationship or have a loved one that suffers from addiction or alcoholism. And so, being able to have that community support of, I'm not alone in this. There's other people who are going through this that can provide support and help guide me whenever I might feel responsible for taking their recovery into my hands. And so that's a huge thing, I would say, just being able to practice those 3 C's and recognize where my where my actions start and what I can and can't affect. So Nar-Anon and Al-Anon, absolutely. And, I encourage individual therapy. I will say, and maybe we'll get into this more, but I would wait on trying to come together and do, for example, like couples or family work right off the bat when somebody's getting clean. There's a lot of stuff that's going on right then. So it's kind of like maybe waiting a little bit down the road for that.
To focus more on individually kind of in the beginning before you bring in that relationship piece. And could you, before we move on from this subject, I really want to ask you to explain a little bit more about what you mean. Most of the time when we think about the term enabling, we think of it as a negative, enabling someone in a negative way, but you mentioned enabling in a positive way. So can you say a little bit more about what you meant by that and what that looks like?
Yeah. So, something that comes to mind around that is like caretaking versus caregiving. And so if I'm, taking away somebody's autonomy, I'm not really allowing them the opportunity to build their own, self-esteem. And so, when I'm taking away somebody's ability to do that, they're not gaining that. But what I can do is allow myself to be, accessible to them. So one example that I'll give, and this comes up a lot in the family program, family members will often ask, well, what if they can't get a ride to a meeting? And I see that they're at home and they're struggling or whatever. Can I give them a ride to a meeting? That's a kind of conversation that we'll have. And what we encourage is that you allow that person, your addict or alcoholic or whatever, however you want to phrase it, you allow them to come to you. And so, it can be very difficult to sit there and watch them struggle to, okay, they didn't find a ride. Are they going to go? Have they called their sponsor today? Can their sponsor pick them up? What's going on there? And so there's a lot of uncertainty and anxiety that's likely to kind of come up around that. But enabling their recovery kind of looks like stepping back from that and saying, one, that's not my responsibility. It's up to them to be able to get to a meeting. It's up to them to stay on the, in contact with their sponsor or network and really handle their own recovery. And so I'm actually enabling their recovery by taking a step back in that situation. And then also making myself available, because if I'm not extending myself beyond, my means, I can absolutely help them. But what's important is that I'm not caretaking. They're coming to me and saying, hey, can you help me with this? And then I can do that as long as I'm not compromising, my boundaries or, like I said, kind of going beyond my means, if that makes sense.
Yeah, I think that's a really helpful way to look at that. I think that, to some extent, when we think about this population of people who have a loved one who has an addiction, often that those terms like enabling or codependent have also kind of their own level of stigma. But the way that you just described that really helped me to think about how people can view them as having that role, but still having a supportive role, but still being able to have boundaries with that. And it speaks to me, again, the importance of seeking out that help, whether it's from a counselor or from a support group, because it's a fine line between, enabling in a positive way and enabling in a negative way, I think.
Yeah, yeah, and there are so many like specific situations that will come up, and unfortunately, we don't have a manual, that outlines like this is every situation and how to respond, and that's why exactly, why we're encouraging like, find a therapist, find a community, find a group of people, a community of people who are also asking the same questions and who are seeking the same thing, and being able to have like a sponsor, an Al-Anon or an Ar-Anon, allows you to run those questions by somebody else who's had experience maybe making a beneficial and a non-beneficial decision in each situation, and has that experience.
I think those are really great points. And I think we could probably talk about this little sliver of this issue for the whole program, but we do want to kind of move on to some other topics, and especially let's kind of look at maybe the point at which someone is willing to seek treatment. And what does that, I know that person in the treatment process in many ways is very much focused on themselves and their relationship with their substance, but at what point do they start thinking about repairing their relationships with others as well?
Yeah, so kind of like I had mentioned briefly, that process is definitely play the long game, if you will. In early recovery for the loved one and for the addict or alcoholic, like it's very much like focusing on their own individual kind of process and recovery. And I'll just mention, in the 12 steps, steps 8 and 9 are basically where, amends are made. A list of amends is written in step 8, and then step 9, those amends are made to individuals where basically, unless harm will be done by making those amends. And so, that's kind of pretty far down the line as far as, 1 through 12. And so, it takes some time to be able to, clear my side of the street and kind of say like, okay, I'm taking care of my recovery and I'm changing and growing. And I'm not treating people the same way that I was before. It takes a while to kind of get to that point. And people in here in treatment and in early recovery in NA and AA, a lot of times we say like, don't go and say sorry right now. Our family members, our loved ones have heard it and over and over and over again, likely, I mean, in many situations, I'll say. And so it can be so much more impactful and meaningful for everyone involved if that comes after a period of abstinence and it comes after some real individual work. And so, there's a lot going on there. And each situation is different. And so some people don't necessarily have the luxury of being able to just step out of relationships. Right. And so, and here 28 days, that's a good start. We often recommend sober living and intensive outpatient when people leave here before transitioning back to, living with their partners or families or whoever. And, when people transition back, that's kind of when that starts, whether or not we want it to or not, because you're in that environment, you're with that person. And so I think that having that foundation is really important. And it kind of allows you to right off the bat, when things arise in your relationship, you're able to start the repairing just simply by not responding the same way that you were before. And then in time coming together, and I definitely would recommend like couples counseling or family counseling at that point a little further down the line. And to give like I often recommend 90 days of sobriety for the individual, and then 90 days of individual work for the family member or loved one, just as kind of a generalization there.
Yeah, I'm glad you provided that timeline. And of course, everybody in every situation is different, so that shouldn't be viewed by people who are listening as a hard and fast rule or a rigid prescription for the timeline. But that's a long time, and as a loved one, I would imagine it would be very frustrating, while you're waiting, and maybe wanting to work on things, especially if you live with that loved one. So do you have any tips for just how to cope and be patient, while you're waiting until it's the right time in the recovery process to really start the process of repairing relationships.
Yeah, I mean, it is frustrating because it's like this person who's been in active addiction has been living, selfishly, um, putting substances in their body to continue using and kind of disregarding anything else that's going on. Now, as I mentioned before, from the disease model, what we're advocating is that a person doesn't have a choice in that situation. But regardless, they're affecting those relationships and they're not present for those relationships. And so that's very damaging, to people that they're in relationships with. And so, yeah, it can seem selfish to start like, all right, I'm gone for 28 days to work on myself, and then I'm going to do IOP and sober living, and I'm not going to be there. It seems selfish in some ways because that person's working solely on themselves and their recovery and trying to figure out, other issues that are going on there. And so I think going back to something I mentioned earlier is helpful in this situation to kind of say, that this person likely has been using for a long period of time. And even prior to that, the addiction was likely present some way, or, just the beginning stages, the early stages of that. So it's, again, it's many, many years of conditioning and preparation for this. Now they're getting clean and so comparing those two, it's very, they're very different. One is very short and the other has taken an entire lifetime to get to that point. And so we can't necessarily expect that recovery process to be short. And so I think just having the mentality that, it's going to be a long process, and also having the mentality of if they're working on themselves right now to stay clean and they're really truly investing in that, that's ultimately going to result in a fulfilling, relationship. That's ultimately going to result in somebody who is present, as opposed to how that person was living or acting when they were in active addiction. And so just having those two things in mind, I think could be helpful. Just that it's going to be a process, and then also that, the perceived maybe selfishness of this is ultimately going to result in a more enriching relationship with the person long term.
And I'm so glad you mentioned that too, because I think that long range view is so important. And that is another reason where if you're in a support group or if you're able to connect with friends or people in your community who also have been through that process, that it can be helpful for somebody who's kind of in that immediate process, looking at their loved one in the middle of the addiction and the early recovery process, but to know people who've really kind of worked the whole way through that recovery process and to see, what wonderful sort of growth they had through that. And then to be able to take that and help that be a lens through which they might, be able to really see the potential future growth for their partner or their loved one, even if it's not there yet.
Mm-hmm. Yeah, definitely. And, even just like that just made me think about the fact that, when we first worked the 12 steps, we're focusing on the substance use disorder or, the addiction to the substance and applying the principles to that. And then over time it changes. I mean, the bottom line is still abstinence and being able to stay away from the substance. But then you start applying things like acceptance and surrender and powerlessness to relationships, to, life situations, things that go so far beyond just the substance. And so it's a lifetime process, that requires in the beginning a lot more attention, and then over time it can be more spread out and just kind of maintenance along the way.
And so let's talk for a minute too, because I think that up until now in the conversation, we've sort of been referring to the addiction as the main problem in relationships that people would have had. But there's a lot of other negative relationship challenges that can go along with addiction, whether or not they're sort of related to or caused by it. But you could have certain levels of deception. You could have in a couple relationship infidelity. You could have feelings of betrayal, violence or abuse could be there, so there might be a lot of other, really significant relationship challenges. So how do you sort of tease all of that apart, not just sort of patiently maybe waiting while your loved one is working through the recovery process, but also addressing these other very specific potential relationship issues that might have happened at the same time?
Yeah. I mean, that is a really hard question, I think, to answer, because the issues that were spawned as a result of the addiction, are oftentimes traumatic and difficult for both parties. And what we're saying is that an individual who's suffering from the disease of addiction is making decisions based on a perceived sense of fight or flight, or a perceived sense of safety, that I have to have this in order to survive, basically. So a survival aberrancy. And so whenever that person's going through that, I mean, they're just wreaking havoc oftentimes in life. And so in order to work through that stuff, it's important to tease apart, who is this person, and what's the addiction, and being able to see both of those pieces very clearly, because they're different. When you're looking at somebody who's in active addiction, yes, it's their body, but it's not really their mind. I often use the reference of flipping your lid. So it's like, if this is the frontal cortex, when the addiction's present, that's offline, and you're working from the brainstem. You're working from survival. And so having that in mind, I mean, it's not okay, and it's not a justification or rationalization to say that what these people have done while they were using is okay in their relationships. And it's going to take time for those things to be resolved, and to be able to tease apart, okay, this is the addiction, this is the person. And so, like I mentioned with steps 8 and 9, I mean, that's when the formal amends process will happen, but by no longer treating, others the same way that they were being treated in active addiction. That's really the first steps. Now, when there's like violence and other kind of traumatic experiences that have happened along the way, I mean, I think that it's definitely going to take some couples and family work to really get at those issues and resolve them. And I don't think there's really a quick fix for it. I think that it's like, okay, focusing on individual recovery, playing the long game there, recognizing the difference between the addiction and the individual, allowing that person to make those formal amends, and holding them accountable for the things that have really hurt you. And so being able to communicate honestly what effect this addict or alcoholic has had on you, being able to share that openly, honestly, and without any hesitation of like walking on eggshells, like not feeling like, oh, if I say this, are they going to use it against me, or are they going to say that, oh, this is going to make me use? No, you're like we mentioned before, can't cause it. You didn't cause it. You can't cure it. You can't control it. And so, it's just not really even a question. But being able to communicate that honestly and kind of work through those things, definitely in therapy, I think it would be my recommendation there for sure.
Yeah, and I think too, sometimes it is helpful to take like a big problem like that, or a big ball of problems, we could call it, and start to kind of break it down and break it into different pieces. And, especially if it's somebody where there's been just a lot of specific relationship challenges, such as if, for example, we're talking about a couple, maybe there's been infidelity, maybe there's been, whether or not it's physical violence, but verbal aggression or other forms of abuse, deception, any one of those could be something that somebody might consider, sort of a deal breaker, or something that they don't want to move past. But I think sometimes when you're trying to look at the whole picture at one time, it's hard. And especially if you are trying to be empathetic and separate the person from the addiction, that's difficult. So I think in that case, again, definitely seeking that counseling and support is helpful, but also potentially part of that healing process for the loved one is really looking at each of those issues and acknowledging the hurts of those, knowing that those hurts are, make sense in the context of those experiences, and getting the support to work through those. So do you have any other thoughts on that, or kind of how somebody might heal from those pieces?
Yeah. I mean, just one other thing that's kind of coming to mind is just being able to recognize again, like what I am and what I'm not responsible for, and what are my motivations behind the things I'm doing. As far as am I weaponizing something? Am I using it because am I trying to control or manipulate a situation? Or am I just honestly communicating how I feel and I need support? I mean, being able to kind of see like what are my motives behind my behaviors. And then another thing, that I think is actually really important to mention here is just setting boundaries, and what you are and aren't okay with, and being able to have flexible boundaries, boundaries that aren't so rigid, but something that I can stick to. If I'm saying, oh, if you use, I'm going to kick you out, but I can't stick to that. When it actually happens, I'm not sticking to it. It's not helpful. But being able to, find what those boundaries are. Maybe it is a boundary of, if you're verbally abusive, then I'm going to leave, or whatever it may be. Being able to figure out what those are for you, like you said, those like kind of firm lines of like, this is enough, and being able to have a plan in case that happens. Have something to fall back on, that allows you to have the support you need, and either have them leave or you leave the situation, or whatever it may be.
And I think that is another place where it's so helpful to just get that support and not try to figure out all of that on your own. But whether it's a counselor or your friends and family, to say like, what makes sense here? Am I being too harsh, or am I not being firm enough in this area? That's difficult to figure that out even in any relationship. Boundaries are such a complicated aspect of relationships in general, let alone when you factor in the addiction piece as well, then it can get really complicated. So do you have any other guidelines on really how to set those boundaries? What healthy boundaries look like in relationships?
Yeah, I mean, just some thoughts that are coming to mind. Like I said about making sure that it's something you can stick to. I think that's probably one of the most important things, because if I'm just saying it and I don't stick to it, then it's really a threat, and it's not really going to be helpful for me or the other person. But if I can, say, if this happens, then I will do this, and not coming from like a punitive place, but really coming from a like, I love myself and I want to take care of myself, and I want to make sure that I'm cared for and getting the respect and love and appreciation that I deserve. And so that's why I'm putting this in place, rather than making it about the other person. And so I think like just approaching those boundaries with that mentality of like, it's out of self-protection, it's out of self-love, it's not coming from a punitive place. And it makes it way easier to hear that on the other side. And it might even be encouraging for that person to want to keep up that boundary.
That's great. Yeah, I think really coming from that place of, I'm trying to take care of myself here, not trying to punish you or make you feel bad about yourself. But and I think sometimes people don't know what boundaries they feel comfortable with and what they don't. And so really spending that time reflecting on what they feel comfortable with, what they don't feel comfortable with, is really important too.
Yeah.
So we're down to our last like 15 minutes or so. So for those who are here live, if you have any questions, please do feel free to continue to post those in the chat room. But for our last topic, or our kind of big picture topic, we're going to be talking about how to help a loved one along that journey. So we've already touched on this quite a bit throughout the program, and sort of understanding that it's a long-term process, that there's different phases. I think at a real basic level, what are some good resources where a loved one can learn about things like what if their loved one goes away to a treatment program for 28 days, what is happening there? Or what does it mean to go to AA or NA? Or how do you, what should people know at a real practical level about what, positive recovery looks like?
Yeah, that's a great question. As far as where I'm coming from with my experience professionally and personally, mostly what I'm talking about here is like abstinence-based programs, 12-step and stuff like that. And so I do want to acknowledge, there are people have found success in other ways of treatment. But yeah, as far as like what's happening, in a 28-day treatment program, and what's happening in 12 steps, when we get guests here in treatment for 28 days, we're kind of assessing what is the severity of this. We don't admit anybody who doesn't meet criteria for a severe substance use disorder. And so if you get here, you've already met criteria for that, but we start with the exploration of what that means for you, right? And so seeing like, what are the consequences that have come from your addiction? And so, as the disease, as we talk about it, is cunning and baffling. So it's trying to prevent itself from being seen in its entirety. And so a lot of what we're doing is looking at, okay, what actually has happened as a result of this addiction, and how can we transition from blaming ourselves for this and recognizing that we actually have a disease. So that's a huge part of what we do. We start to talk about the first step, especially in recognizing, the powerlessness over our addiction, as well as the unmanageability that comes with it. And so ideally, in a 28-day treatment process, an individual will come into treatment and be able to recognize, okay, I do meet criteria for substance use disorder. Either identify as an addict or an alcoholic, and begin the 12-step process and kind of have an introduction to that while they're here. Each individual's process is obviously going to look different based on where they're coming in and how intense their addiction is, and just where they are in life. Sometimes it might be somebody's first attempt at treatment. That looks a lot different than someone who's going to treatment for their fourth or fifth time, as the response from family members and loved ones is also very different. But, ideally leaving a 12-step based treatment facility like Fellowship Hall, you're going to have an understanding of what it means to be an addict or an alcoholic. And a basic knowledge of at least the first 3 steps and the principles kind of behind that. And hopefully, be able to gain some insight into some of the motivations that have taken place as far as like, why is this person using outside of having the addiction, and a lot of times it's emotional, it's spiritual, it's existential. And so being able to start gaining some insights as to, what are the motivations behind my use, and why have I, continued down this path. As far as 12 steps, the best way to really explain it, it's a lifetime process. In the beginning, it's just arresting the addiction, and then it's about maintaining that from that point on. And so you'll hear oftentimes in 12-step meetings, maintaining the fear, maintaining a sense of, fire, maintaining the fire for recovery, because that bottom line is, what we're saying is that if we use again as addicts and alcoholics, that will result in jails, institutions, and death. And so if those are the options, it makes it pretty clear to want what the other side of that coin is. But yeah, early on in the process, it's arresting the addiction, and then it's learning about ourselves, really, and learning how to apply principles to ourselves and our relationships.
And so that was very helpful. I think that sometimes for people who don't have a lot of familiarity with the world of addiction and recovery, they sort of think, oh, AA or like a 12-step program, these are all terms that are sort of used a lot, but a lot of times people don't know what really is involved in it. So I think it's helpful as a loved one to be able to know what your loved one might be going through. And through that, I guess I would imagine that some of the ways that loved ones can offer support at different parts of that process are working on themselves and getting their own support. A lot of these things we've already talked about, learning about that process, educating themselves about it, participating in programs like you mentioned earlier, like a family program, whether it's going to Al-Anon or Nar-Anon, as you mentioned. But really, you know, kind of all of those pieces would be ways of offering support during that process. Are there others that you would add to that list beyond what we've already talked about?
No, I think you covered it. I mean, you know, one of the things just to consider that it's in line with that is, again, this enabling behavior. And so being able to help somebody down, you know, is kind of how it's phrased at times, can be really helpful. You know, if I'm catching somebody's head every time they fall, they're never experiencing that pain. And so that pain ultimately is what drives a lot of people into getting clean and staying clean, you know, and being able to step away and, as difficult as it is, allow somebody to experience the consequences. You know, it can really be life changing. And so, but also being able to live with the fact that, you know, they might experience some pretty severe consequences as a result of me stepping away. And that's where it gets really difficult.
Yeah. And I think that is the last kind of really specific piece that I wanted to touch on too, is about setbacks too. You know, we've sort of been talking about recovery and this maybe idealized version that you start recovery and then you just walk through it and then you reach the end and you are, you know, grown and you've learned your lessons and you're going to be free from the addiction. But a lot of times it's like 2 steps forward, 2 steps back, 3 steps forward, 2 more steps back. You know, it can be a bumpy process. And I definitely heard the piece already about letting people experience some of the consequences of setbacks. But do you just have any other thoughts too about just sort of navigating setbacks or challenges along that way when it isn't that sort of idealized version of, you know, the super recovery process? It just everything goes smoothly from start to finish.
Yeah. I think being able to find negotiations along the way with those, you know, those flexible boundaries. You know, one of those examples being, if you use again, you know, I'm going to have to ask you to leave. And so, you know, just say in a hypothetical situation, this person stayed clean for 6 months and then they have a relapse. And so, you know, maybe at this point, that was a boundary that you had set, but now you recognize, okay, it is a relapse. You know, they've returned to use, but they picked up once. They're back in meetings, they're calling their sponsor, they're doing all these things. So it may be important to, along the way, reassess those boundaries and say, is this still realistic for me? Or is there something else? And maybe it's, I need you to go to a sober living facility for a month and then return, you know, and maybe just finding kind of compromises along the way and just not being so rigid with those boundaries, I think, is important. With that being said, if it does become this person's continuing to use and harm you in one way or the other, recognizing at what point, you know, do you say it's enough and you know, you don't want to be in that situation anymore, which can obviously be, you know, difficult to step away from, but just being able to come from a place again of that self-love and that protection and being able to say, like, okay, you know, am I extending myself beyond my my means, and am I compromising who I am and compromising my principles for this person? And, you know, but yeah, I think just having those flexible boundaries and looking at that along the way, and again, having that support like from Al-Anon and Nar-Anon and therapy and all those things kind of come together and help us, I think, make those decisions as they come up. Mm-hmm.
And I think too, another piece of that is just really thinking about, you know, using all of the resources available to you. That's something we talk about a lot through the Healthy Relationships Initiative, but we've talked about a lot of different resources like recovery and treatment programs. individual counseling, family or couples counseling, support groups, 12-step programs. But I would add to that too, just thinking about maybe some of the secondary challenges or issues that might come up. So there might be financial challenges, there might be career or educational resources, but just learning about what those resources are, being willing to reach out for help. I was thinking that when you mentioned about a sober living facility, I know that some college campuses like UNCG, for example, have collegiate recovery programs, and a lot of people don't know about that. And so I think for people to really, it's a good investment of your time and your energy to spend some time searching for resources in your community that are available to help, not just specific to the addiction, but also offering support in other ways too.
Mm-hmm.
Are there any other resources that you tend to find to be helpful among the clients that you've worked with?
Mm-hmm. Yeah, there are lots of different types, I guess, of sober living, and sometimes people will leave here and go into other partial hospitalization programs, that are 5 days a week, very, involved. So individual groups and lectures and things like that. And that's, yeah, I mean, PHP programs, IOP absolutely would recommend. And sometimes that can be helpful for maybe someone whose addiction hasn't progressed to the point where they feel like they need a 28-day treatment stint. They can just be involved in IOP. Sober living is absolutely beneficial. It's helpful to be around other people who are also early on in that process, who can support you and hold you accountable. And a lot of times with those, there are drug tests and curfews and requirements to kind of living in those facilities. And then there are others that are more focused on psychiatric and co-occurring disorders that I've definitely, referred people to in North Carolina. And then there's longer programs that can be really helpful for maybe people, younger guests in treatment, and oftentimes people who have been through this process several times and have found benefit from structure. It can be helpful to stay in those more structured long-term programs and then transition at a later time kind of out of that.
That's great. And those are definitely some really great resources to know. And a lot of times people don't really understand those extensive options of resources that are potentially available to them. So before we wrap up, could you share your kind of final thoughts on what you hope are some main takeaway points that people will walk away from today's program with?
Yeah. I mean, we've covered so much today. It's difficult to just narrow it down to a few things, but I definitely want to say that education is so important, because I think it informs kind of everything when you're dealing with addiction and dealing with a loved one who's suffering from addiction. That's one of the main points I'll say. The 3 C's I think is also really, really important. It can be very relieving to realize I didn't cause this. I can't cure it, I can't control it, and so I can contribute in a positive way. I can enable their recovery. That's kind of the second thing that I would mention. Third, I would say, kind of as a blanket term, I guess, would just be play the long game, be patient. I mean, it's as difficult as it can be. Allow for the early stages of recovery to be individually focused and giving time to yourself and coming from that place of self-love. And that's something I haven't touched on as much today, but I think like outside of kind of like we've mentioned, those resources that are like more primary resources, doing things that you enjoy again that you really didn't have time to do when you were trying to control this person's addiction. Maybe that's a spiritual or religious practice. Maybe that's a hobby or interest, and really just investing in you again. Because a lot of times being in a relationship in any form with someone who's in addiction is exhausting, and really can take away from your own personal identity. And so being able to just, again, invest in that and kind of playing the long game there. Those I think are my 3 takeaways.
Yeah, those are some of the main points that I've learned from you today too. So I'm glad that was a great recap. The last thing that I'll say too, that I've just been thinking, especially as we've gotten toward the end of this conversation, has just really been about the importance of having good overall general relationship skills to help navigate some of these challenges. So just, you know, again, we've got a lot of great free resources through the Healthy Relationships Initiative on basic skills like communication, conflict, problem solving, you know, those sort of resources, because all of the things that we've talked about today could be huge sources of tension and conflict. And if you don't have some basic sort of foundational skills to help you navigate those, then it can really turn those kind of smaller potential issues into really negative dynamics in your relationship. So we always like to plug those healthy relationship skills, but I was just thinking how critical they would be, especially if you're navigating this process. But well, Bernard, it has just been great having you with us today. Thank you so much. It was fun to trade teacher-student role for the time being and to learn from you. So thank you for being here.
Absolutely. Thank you so much for having me.